First and foremost, I'd like to pay tribute to all of our staff doing a fantastic job right across the country, working flat out to help as many patients as possible and to save as many lives as possible. And I know how enormously challenging the current situation that we find ourselves is. And you can be absolutely assured that I will do everything necessary to support and protect our staff right across the country. And my absolute commitment to achieving that number one top priority is supported as well by all of the chief execs in each of the ambulance services right across the country. We will work night and day to ensure that we protect you, protect your families, so that you can help all of our patients and save as many lives as possible right across the country. I need to be very, very clear about that top priority. We recognise the pressures that our staff are confronted with. We recognise the pressure that they are under, and we will do everything necessary to support them. It's really important that all of our staff please follow the national guidance issued by Public Health England. We are advising the national bodies on the work that our ambulance staff undertake and how it's different from other parts of the NHS, and the different circumstances and the challenges that ambulance staff are confronted with on a daily basis. There's certainly enough PPE available to the NHS and available to ambulance staff. I'm told by all the ambulance chief execs that they have sufficient supplies for their staff. I do accept that supplies have got low in a few places, but I also know from feedback from colleagues, from ambulance chief execs, that there is sufficient supplies on ambulance stations right across each ambulance service area. If staff have concerns either about the guidance that they're expected to follow for the wearing of PPE, or indeed the flow of supply onto their specific ambulance stations, please inform your chief exec immediately so they can take immediate steps to ensure that that supply, which is being pushed out nationally into individual ambulance services, continues its journey to reach frontline staff on all of your ambulance stations and on each of your emergency ambulances. Nothing is more important to us. The PPE guidance has changed since the initial stages of dealing with COVID-19 and will be under constant review by Public Health England and the National Chief Medical Officers, and the ambulance service will continue to ensure that we embrace that guidance and that we implement that guidance in order to protect all of our staff all of the time. It's absolutely essential that all organisations, including the ambulance service, comply with the social distancing arrangements that have now been put in place to protect staff whilst they're at work and travelling to and from work. And I know that ambulance service is working flat out, working really hard to make sure that there is sufficient space between all of our staff when they're undertaking their important work, whether it's in control rooms or any other functions that we continue to have to undertake in order to protect the public, protect our staff, and to save as many lives as possible. Staff testing has been something that I've been pushing for a good few weeks now, because we know that there are staff that are having to self-isolate, and there is a sense of frustration between some staff knowing that they need to self-isolate but actually knowing that they could probably come back to work as well to help their colleagues and to help patients. I'm very pleased to say that there was an announcement made over the last few days where a top priority for staff testing, the ambulance service are included in that top priority group for staff testing, and it's already commenced in many parts of the country and we rolled out and scaled up over the next few days so that we can get staff tested as soon as possible, support them where that's necessary, and where they're able to safely return to work, embrace them back into the workplace alongside their colleagues, helping our patients. And so finally, I'd like to place on record my enormous thanks to all of you for what you are doing. I am personally in fantastic work that you're undertaking and really impressed with the way in which everybody right across our organisations is stepping forward to help patients. I've been in the ambulance service 35 years and enormously proud of everything that you are doing to uphold the values of the NHS, to uphold the values of the ambulance service. And you can be absolutely assured of my continued full support. If there's more that you think I can do to help you, to support you and your families and your colleagues, please let me know directly if you think I can help further. But in the meantime, a really, really big thank you. Please look after each other and please stay safe.